Hello and welcome to the EpiPen certification training for Franklin County Schools. This training program was created by the National Association of School Nurses and has been modified to include information specific to the policies and procedures of Franklin County Schools. The objectives are for you to learn the signs and symptoms of anaphylaxis and learn how to administer an epinephrine auto-injector. North Carolina law requires all public schools to provide an emergency supply of epinephrine auto-injectors to be used by trained school personnel in providing emergency medical aid to people having an anaphylactic reaction during the school day or at school-sponsored events that are held on school property. Students with known conditions requiring epinephrine should continue to supply their own medication in accordance with Franklin County School medication policy. Each school principal is responsible for designating staff members that will be trained in the use of emergency epinephrine auto-injectors. The law also requires that trained staff have certification in CPR. Each day we have hundreds of people, including students, staff, and visitors, on our school campuses. They may have many different health conditions, both known and unknown. We are going to discuss how to recognize and respond to severe allergic reactions or anaphylaxis. In this scenario, a student is stung by a bee at recess and tells her teacher that she is having trouble breathing. The teacher notices that the student is pale, her tongue appears to be swelling, and the teacher can hear wheezing and gasping for air. The student in this scenario is having a life-threatening allergic reaction called anaphylaxis. Without prompt treatment with a drug called epinephrine, she could die within minutes. So what is anaphylaxis? A severe allergic reaction that can be fatal is called anaphylaxis. Anaphylaxis involves all major body and life organs and is much different from seasonal allergies. This is an emergency. This type of reaction must be treated immediately, as a person's symptoms can quickly progress and the reaction can become life-threatening within minutes. The drug of choice is epinephrine. Epinephrine is available in auto-injectors, which are designed to be given by people that are not healthcare professionals. These auto-injectors are commonly known as EpiPens and are now available for use in all schools in North Carolina. The purpose of this training is to help you be prepared to respond appropriately. An allergy occurs when the immune system mistakenly attacks a food protein or other normally harmless substance because it perceives the food or substance as a harmful or foreign one. Exposure to the offending food or allergen may trigger the sudden release of chemicals including histamine, resulting in symptoms of an allergic reaction. The symptoms may range between mild and severe, and they can progress over minutes or hours. The first time that the body comes in contact with the substance, there may be little or no reaction, but repeated exposure can cause a reaction. Each reaction may produce symptoms that appear similar or different from previous episodes. The most common allergens are bee stings, latex, and various foods. The foods listed in this table comprise 90% of all food allergies. Food allergies are more common than latex allergies. If you suspect an allergy response, you need to assess the person's symptoms, administer EpiPen, and call 911. For the purpose of this training, we are talking about unknown allergens, but if you are responding to someone with a known allergy, it is important to remove the allergen if possible. For example, remove food products from the area, or if outside and a sting has occurred, try to move the person to a different location. If you are questioning if the person is having a severe allergic reaction, they probably are. It's safer to administer epinephrine than to delay treatment. If symptoms do not improve or get worse, a second dose of epinephrine may be given after 5 minutes. Symptoms can range from mild to severe. A person with a mild reaction may complain of an itchy mouth, a few hives around the mouth or face, and complain of a mild upset stomach. A person with these symptoms needs to be monitored, as the reaction could progress to a severe reaction. Severe symptoms may include one or more of the following: shortness of breath, wheezing, repetitive cough. The person may look pale, and they may appear to be confused. They may complain of tightness in their throat. Their voice may sound hoarse, and they may appear to be having trouble breathing. You may notice swelling of the lips or tongue and many hives over the body. A combination of symptoms from different body areas may also be indicative of anaphylaxis. Hives alone may indicate a mild reaction, but hives along with swelling of the lips and/or nausea and vomiting would indicate a severe allergic reaction. If you suspect anaphylaxis, it's important that you know what to do and act quickly. Each school site has a yellow epinephrine cabinet located near the AED. In each yellow epinephrine cabinet, there are 2 boxes of epinephrine. The green box is to be used for people weighing less than 66 pounds. If you are unsure of the person's approximate weight, you can use the green measuring tape to assist you. If the person is shorter than the length of the tape, administer the EpiPen in the green box, which is 0.15 milligrams. The EpiPens in the yellow box are to be administered to people weighing more than 66 pounds. If you are unable to determine the person's weight, always administer the 0.3 milligram dose in the yellow box. Also inside of the cabinet is the Franklin County Schools Protocol for Anaphylaxis. The sheet gives instructions on what to do if you see the severe symptoms we just discussed. It also identifies mild symptoms and the need to monitor the person for further signs and symptoms of severe allergic response. There are also written instructions for how to administer an EpiPen in the cabinet. According to the protocol sheet, if a person were to be having any of the severe symptoms, you would need to inject epinephrine, hold it in place for 10 seconds, have someone call 911, and monitor the person until EMS arrives. Below the picture are instructions for what to do once EpiPen has been given. Note the time that it was given, stay with the person and have someone contact a relative, have the person lie down unless they are vomiting. If the person does not appear to be getting any better, you may administer a second dose of EpiPen in the other leg. Any person who receives epinephrine must be transported to the ER. The last thing we need to do is document our actions. We will discuss what to document in a few minutes. Epinephrine auto-injectors are easy to use and come with instructions. Not only are the instructions on the EpiPen, but we have also included them in the EpiPen cabinets. This list has some of the most commonly used epinephrine auto-injector brands. Franklin County Schools stocks EpiPens, so we have focused our training on that device. Please click the link on the main page to view a video demonstration on how to use an EpiPen. As a review, if a person has symptoms of anaphylaxis, follow the EpiPen standing protocol and call the school nurse if available. Give the EpiPen without delay. Administer a second dose in 5 minutes if symptoms have not improved and EMS has not arrived yet. If epinephrine is going to be administered, go ahead and have someone call 911 to get emergency response on the way. Notify the person's emergency contact. Administration of EpiPen must be documented on the provided documentation form that is located in the EpiPen cabinet. Documentation needs to be completed in black or blue ink, and copies of the completed form should be given to the school nurse, the principal, and a copy should be sent to the lead nurse's attention at central office. Following the incident, your school nurse and administration should meet with you to discuss the incident and any recommendations for changes to the EpiPen protocol. We would like to thank you for being willing to learn how to respond and possibly save someone's life in the event of an anaphylactic reaction. Please return to the main page and click on the link to sign in and print your certificate. You will need to contact your school nurse to set up a time to demonstrate how to use an EpiPen and to ask any questions.